Hi everyone, thanks for joining me again. Dr. Jeff here from Ear Care Specialists in Nottingham. So this particular patient I haven't seen for about 2.5 years. Their ears were completely ram-packed full, and here we are just trying to get it out. So we'd used a bit of oil at this stage just because it was really tough and stuck, but we've got it and it's starting to mobilize. You see, here we go, just pulling it out. So we'll get rid of the speculum in a minute and you'll be able to see just how big it is. There it is coming out of their ear. Instant relief. Thanks for watching. Welcome back everyone, Dr. Jeff, Ear Care Specialist Director here. Thank you for watching. This is quite a satisfying one. We've got a fair bit of hair in the ears, which is just preventing the wax from being able to naturally migrate out of the ear. Eventually it comes though, and we've got a huge plug coming out. There you go, enjoy that one. I'll move out of the way. Bye. Welcome back everyone, Dr. Jeff from Ear Care Specialists here. This patient had a very large hard lump of wax in their ear, completely blocking their ear off. They'd just been on a flight and they felt some pressure. They couldn't quite get any relief, and here we are just bringing it out from their ear with skin trailing as well. Hope you enjoy. Welcome back everyone, Dr. Jeff, audiologist from Ear Care Specialists here. So this is a nice particular case because it illustrates the effectiveness of sodium bicarb drops as a quick application during the appointment. So this patient came in, they had this very sticky wax that wasn't really budging. I knew pretty much straight away that it wasn't going to come out. So you can see a little bit break off there, but rather than wrestle it for a few minutes, we did one spray of sodium bicarb. I waited about 3 or 4 minutes. Have a look at it now. It's completely changed colour, it's glistening, it's actually, you see the little bubbles within there as well. And then when we go back in and apply the suction, it just makes life so much easier. So it comes straight out just like that. Brilliant. Thanks for watching. Hi folks, Dr. Jeff here. Here's a nice quick one for you. Wax is right at the edge of the ear canal. Suction on, give it a wiggle, and out it comes, just like that. Welcome back everyone, Dr. Jeff here from Ear Care Specialists in Nottingham. So with this particular case then, it's a patient who has recurrent wax problems. They come into the clinic about every 6 months, they're well aware of it, and they just manage it with some olive oil, and then they come and see me to have the wax removed. It's causing hearing loss, as it often can when it's fully occluded in there, and it's just not very nice having it in the ear. I've got this on a times 12.5 magnification because the ear canals are very, very small, and you see straight away this first plug of wax comes out. It doesn't look huge there, but actually it's enough to block the ear off. So once that comes out, they notice an improvement in their hearing immediately. As we go back in and have a look, you will notice on the floor of the canal there's still this ridge of wax and some skin debris, and we're going to try and get that in a second, but you have to be a little bit careful because it can stay sort of stuck to the canal, and sometimes you can, when you lift that up, it can be a bit tender underneath, so you have to be mindful of that. And if it looks like it's wiggling and it wants to move, then great, we pursue it. If it doesn't, then you might advise more oil drops. You'll see the clip just flash there. What we've done is actually use just one spray of sodium bicarb. You see, for about 2 minutes, just let it sit in there, and that's just loosened it off a little bit and just changed the colour as well straight away. So just trying to have a little peel of the skin and the wax there. There's this big chunk on the side that we're just able to get. And what I decide actually is just to leave the other bit alone, because we can now see the eardrum and the ear is now free of wax. So in other words, the hearing is restored. There's really no need to remain in that patient's ear. Thank you for watching. See you next time. Welcome back. This is Dr. Jeff, audiologist and director of Ear Care Specialists. So with this particular case, we had a double whammy of wax come out. It's quite a nice one to see. And from a patient's point of view, again, they had significant hearing loss, and also their tinnitus was heightened. You see that first chunk come out there is literally like a raisin. And then we go back in, only to find the same again back in their ear. They work in quite a dusty environment. I'll just say patients who often work in dustier environments, the natural body's response is to produce lots of wax, and it's a protective mechanism, so it's trying to trap the dust and the debris from their environment. So I do often see that within the clinic. It's not always genetically predetermined, but it can be as a response to the environment as well. So you see there, we've took a load out, but actually there's still no sign of an eardrum or any light reflexes. So we go back in for a second time. The wax itself is quite mobile. You see it moving around there, so it definitely wants to come out. I did do a spray in the ear just of oil before we went in, just to try and loosen things up a little bit, as the patient hadn't done that. And here we go, out it comes. Again, really quite a big one, this one, so the patient will feel much better in terms of their hearing. And where they have tinnitus, the tinnitus often is reduced. They're not as aware of it. So I'm just talking to the patient there, and hence the movement. And then we go back in for a final time, have a good look in their ear just to check that the coast is clear and check on the health of the eardrum. If you've made it this far, thanks for watching. Take care. Hello again everyone, Dr. Jeff, audiologist and director of ear care specialists here. So back with another case for you to have a look at. So this one was pretty cool. The patient had an ear completely full of wax and actually skin debris as well. So they were having hearing loss, and we started with suction. We then moved on to forceps, back to suction. It's quite a challenging one actually. The wax was particularly sticky and dry, so we had to use some oil drops and even some sodium bicarb in the appointment. So here's me getting it to a point where it's just coming towards the edge of the ear canal, and you think at this point, oh great, it's going to come out easy. We're just attaching the suction on there, giving it a wiggle, and we really are playing tug of war with this one. So there's reels of skin, and the actual wax debris is pretty large. The clumps of wax are big. It's wedged in their ear effectively, so it doesn't come out as easy as you think it might. This was good because I had a colleague of mine watching actually, so it was a good training experience for them to see. So we go on with the forceps and we try and get lucky, and we pull out some, the first chunk of 3 in fact. Sometimes with the forceps you can bring it all out in one go, which is great, but this one was really sort of wedged in there, so we weren't that lucky with this one. So we go back in, speculum in the ear, suction going in, attached to the wax, give it a wiggle, try and get it free, and here we go. So this is a big piece of wax that comes out about 1.5 centimeters, again that one, and then we go to look in their ear again. The patient thinks it's all over, but no, there's another one in there, so it's still blocked off. So we go back in the ear, and the next clump that comes out, this is the final clump, is actually probably even bigger than the other one, so it was like pulling a raisin out of their ear. And when you have that much wax in your ear, you really do feel blocked off from the world. With this patient, it was just in this left ear, so it really knocks out their sense of localization. And there it comes out, look, so they were really happy when that one came out. And have another quick look, just check the eardrum. I'm going slightly off from the screen there, apologise from that, but their ears were nice and clear. So thank you for watching. Hi folks, thanks for watching. This is Dr. Jeff here from Ear Care Specialists in Nottingham. So I've got a great one for you here. This patient has got bilateral earcleaning wax, and it's quite soft, but it's encased in a thin layer of skin. Just look how easily it comes out from their ear. So here we go. Just need to move out of the way. Look at that. It's a really big reel of skin and wax. Instant relief for them, so they're really happy. And then that was their left ear, so we moved to the right ear this time. Exactly the same. So speculum goes in. See the wax completely blocking the ear. No sign of the eardrum. It's just going to be deadening the sound that's trying to get down there. And again, just a nice easy one to remove, so just has to see the suction and it comes straight out of their ear. They've been using sodium bicarb. Here we go, same again, just suctions out nice and easy, instant relief, and there you have it. Thanks for watching. Ear, eventually it comes though, and we've got a huge plug coming out. There you go, enjoy that one. Move out of the way. Bye.